Hey guys, this is Dr. Jason Shumard with Integrative Wellness Center of San Diego and also the author of The Thyroid Epidemic. And today I wanted to go into a very important topic in regards to hypothyroidism. What many people don't realize is that 1 in 6 individuals, specifically females, are going to have a thyroid problem in their life. It is a very common problem. And traditionally in the medical model, they're going to be giving a thyroid hormone. So when somebody starts having some symptoms, maybe they start having some fatigue, some brain fog, hair loss, excessive weight gain they can't get rid of, brittle nails, anxiety, depression, digestive issues. Those of you who are watching this video probably have experienced that or know somebody in their life that have experienced some of those symptoms. But eventually they go in and see their doctor, they draw some blood, they see the results come back as a hypothyroid, and then they're left with the office with a thyroid hormone replacement like levothyroxine, Synthroid, something like that. So they start taking the medication and asked to come back maybe 2, 3, 4 months later. And when they come back, in most cases, the levels look better on the thyroid test, the blood work, but the person typically doesn't feel good. And that's a frustrating thing for many individuals because they would expect to start feeling better if everything looks better physiology. But the problem is that most of these individuals are not being addressed appropriately, meaning if your thyroid is no longer producing hormone anymore, something must be broken, something must be wrong. And unfortunately, in the traditional model, you're going to be given a medication to replace the thyroid hormone so it looks good on paper, so your body has the hormone, but you still don't feel good because whatever was causing the problem in the first place is still going to be there. So today what I want to talk about is the potential cause, or actually it's the #1 cause of a thyroid issue or low thyroid hypothyroidism that we see in the US. Because if you just continue to focus on taking a medication and thinking everything's going to be okay, unfortunately, for a majority of individuals that are dealing with a thyroid condition, they do not feel better. They continue to feel worse and worse and worse. And as they do continue to feel worse, in most cases, what will happen in the traditional model is more medication. So we see patients taking thyroid hormone replacement. We see them taking blood pressure medication, cholesterol-lowering medications, anti-anxiety, antidepressants, sleeping medications, and on and on and on. I mean, we see them taking multiple medications for, well, we could really just say it's the symptoms of what's really going on under the surface. So today, I want to talk about the #1 cause and how significant it is, and how unfortunately, for most of you who are dealing with this problem, are not being addressed appropriately, which is why you continue to feel sick and feel terrible. So the #1 cause of a thyroid issue or hypothyroidism or low thyroid is actually an autoimmune disease. What is an autoimmune disease? So an autoimmune disease is where your immune system starts attacking and destroying your own tissues. So some autoimmune you may be familiar with would be things like lupus, right? Or type 1 diabetes, celiac disease, what else we think out there? Rheumatoid arthritis is another type of autoimmune disease. So these are autoimmune diseases where the immune system is attacking the specific tissue. Now, based on the tissue that's being attacked will be based upon the diagnosis. So if it's your joints, it's going to be rheumatoid arthritis. If it's your pancreas, type 1 diabetes, and so on. In this specific situation, what's happening is that the immune system is attacking and destroying and killing the thyroid. And over time, as the thyroid becomes more and more destroyed, eventually it loses the ability to produce the hormone, which creates a hypothyroid situation. Now think about this. Follow me for a second here. So if now your thyroid is no longer able to produce enough thyroid hormone, the blood test shows you have hypothyroidism. Now your doctor is going to be giving you a medication to replace the hormone that your body can no longer produce. Is that fixing the problem in this specific situation? Now, for those of you that I've lost at this point, because you're thinking, well, yeah, because now that I have regular hormones. But think about this. The problem is that you have an autoimmune disease. The problem is that your immune system is actually destroying and killing the thyroid. By giving your body the hormone that it needs, it does nothing to the immune system. The immune system will continue to attack and attack and attack and attack until there's no more to attack. It is the #1 cause that we see for thyroid nodules, for thyroid removal, and thyroid cancer. It's because the more of an attacks you have on the thyroid, the worse it's going to look, right? So for example, let's say that I go up to someone every single day and I punch them in the face. Now over time, after maybe a week or so, their face is bloody, it's bruised, maybe some redness in the eyes, but I keep doing it every single day. Now they've got a broken nose, now more swelling, their face is really puffy and everything, their chin is all messed up, they have teeth that are lost. This keeps getting worse and worse and worse. Now, the question I would ask you is their face the problem? Of course not. It's me is the problem because I'm punching that person in the face every single day. So how in this specific situation where the immune system is literally attacking the thyroid every single day, that it's a thyroid issue? It's not a thyroid issue. The thyroid is an innocent bystander that's being attacked and destroyed. So why is it that the treatment is based upon the thyroid and the immune system is being left unaddressed? And that's the problem why many individuals continue to feel sicker over time, because the cause, the immune system that's attacking the thyroid, is not being addressed. So this specific condition, this autoimmune condition, is called Hashimotos Thyroiditis. So Hashimotos Thyroiditis is the condition which is the autoimmune condition to your thyroid. Now get this, most of your healthcare practitioners in the traditional model are not going to test for this, they're not going to analyze for it, and many of them won't even discuss it with you. And so you may be asking, well, why would they not be discussing it with me or talking to me about it or even testing me for it if it's such a big problem and it's the cause of my thyroid issue and I can get better? And here's the reason why. Because they have no option, there's no treatment they can give you for it. So if there's no treatment in the traditional model, meaning the treatment in the traditional model is either pharmaceutical drugs, injections, or surgery for a majority of the treatments. So if there's no specific treatment they can give you for this, meaning there's no pharmaceutical drugs, there is no reason for them to test for it, analyze for it, or even talk about it. And this is the reason why so many people get worse over time, because this continues to attack and destroy the thyroid and you get worse. Even worse, there's more bad news. Even worse, autoimmune diseases are very inflammatory. They're very dangerous and they can lead to future autoimmune diseases. So if you have this as your problem right now, you could also be developing rheumatoid arthritis, lupus, MS, type 1 diabetes, because if the immune system is attacking one specific tissue, like your thyroid, trust me, it's attacking others. It's not just going to say, oh, we'll affect the thyroid and that's it. That's not how it works. It's going to impact other areas. So you could be developing problems right now. For those of you who know you have this because you've had a diagnosis, maybe a holistic doctor diagnosed it, or you just drove your doctor crazy and he or she finally ran the test to get you analyzed and you found this out, but I guarantee you're still taking the hormones and really nothing else. If you went to your doctor tomorrow and you said, Doc, I want you to test this for me, the test comes back, it comes back positive, guess what your treatment's going to be? Levothyroxine or Synthroid. The treatment will not change, which is very frustrating. Now here is the kicker, the most important thing that I want you to understand, is that in regards to hypothyroidism or low thyroid, 90 to 95% of all cases of low thyroid, the cause is actually this autoimmune disease. So that means if you're watching this video right now and you have a low thyroid diagnosis, you have hypothyroidism, you're taking a medication like levothyroxine, Synthroid, or maybe you're taking a natural hormone like Armour or Nature Throid or WP Thyroid, whatever it might be, those are telling you have a low thyroid hypothyroidism. You likely have, as this is your cause, and unfortunately, it's not being addressed. This is the reason why we do such extensive analysis to find out what's going on under the surface. There are lots of things you can do, by the way, lots of things that have been shown through the research to address this specific condition, to arrest or even stop the attacks on the tissue of your thyroid and likely other tissues as well. That's too much to go into this conversation right now with this video because we want to make sure it's short to give you this data, but there's lots of things that we can do to address this. But I can tell you this, that if you're dealing with this type of condition, whatever needs to be done is going to be specific to you. There is no one-size-fits-all approach. You have to know what is going on with your specific body that is antagonizing or triggering the immune system to attack your body. And we can do that specifically in our office through our discovery process to find out what is exactly going on with you. When we're working with someone with a thyroid condition, if it's truly a thyroid condition or if it's an autoimmune condition for the thyroid, whatever it might be, we always are going to be taking them through a three-step approach. The first step is the discovery phase. What is going on under the surface? Do you have toxicities? Do you have micronutrient deficiencies? What is going on? Are there specific symptoms of tissues, cells, organs that are not working properly, that are dysfunctional? What's happening? Once we have that information, we can then move it over to the optimization phase, which requires customization. How can we optimize the function of the body again? By using lifestyle, nutrition, diets, using maybe some supplementation, nutraceuticals to really optimize the function of the body. And then eventually can move them into the excel phase or the sustain phase, where we can help them maintain that. What nutrition should they stay on? What lifestyle do they live? What maintenance program should they be doing to maintain the overall results? Once we go through that three-step approach, that's how we get the phenomenal results that we get in our office, and patients feel better, get the quality of life back, their family time, they'll go back to work normally. Whatever it might be for them that they want to do, they're able to again because their body is working optimally again. So hopefully today that I didn't go too much into this and lose you in the woods too much here, but it's so massively important that you get this information, and I hope it was valuable for you too as well. If it was, make sure you comment below that it was this was valuable information, because it helps me understand that if I'm giving you the right tools, the right information, because I think this stuff is massive.